Hello, I'm Barrett Jeffers. I'm the head of Japan, Australia, New Zealand, and emerging markets medical TA implementation at Viatris.
Hi, my name is Neda Milevska-Kostova. I'm the chair of the governing board of the International Alliance of Patient Organizations, briefly IPO, which is an umbrella organization of more than 300 member organizations, patient organizations and alliances based in 70 countries and representing more than 50 disease areas.
Global Action Week on NCDs is vital. And I think for me, it all boils down to a couple of the statistics, and it shows we still have an issue in treating NCDs globally. You know, that it's the number one cause of death. It's NCDs still. And so everybody knows this, but what we need is to get that message out. 80% of NCD deaths are preventable.
Well, the Global Week for Action in NCDs is an important time of the year where we summarize the results of the past actions and we really look at the way forward on how we can address NCDs. But, and as we know, 1 week is not enough, but it is still a very good moment in time to advocate on the issues related to NCDs. As we know, and as Barrett mentioned, about 80% of all the NCDs are preventable, and we as patient community, together with the industry, but other stakeholders as well, can do much more than what we are doing right now. And this Global Week is really a good moment to summarize and to see what are the good actions we can take, what are some of the so-called best buys in the NCDs, where with small investment we can actually achieve a lot. What we are teaching our patients is that actually health comes 80% outside of the healthcare system, which means that apart from building on what we are doing right now to raise awareness on the importance of NCDs and how we can mitigate or manage them better, we should also put more emphasis on how to prevent them more, because as I mentioned, when we come to the healthcare system with our disease, it's already way too late.
What we've done, you know, within Viatris and IAPO, if we've actually collaborated together to show how these partnerships can truly impact and combat NCDs, and we developed a patient portal. And there's Patient Academy that you can get that's on, you know, a link within the IAPO site. Gives what it does is basically give a vision where we can actually bring these patient communities together and they can start to take their own ownership of management of their NCDs. And until they're invested in it personally, we're not going to see big impacts. So this is a way that we were able to take a partnership, put some materials out there that do it in a language that's very understandable for the patient to truly have that impact, where we can then show that these partnerships, because if you're not involving all of these stakeholders in these partnerships, you're not going to impact the NCD. And that's why it's vital to bring it back to the patient, which is sometimes one of the neglected stakeholders, believe it or not, when we're actually going through this. Societies, governments alone cannot, you know, do all of these things.
They really present the issues in a lay language, which is sometimes very difficult for the providers when they speak to the patients. So we can see also an influx of healthcare providers using the academy to the point of understanding what is the level of knowledge that the patients have and how they can address specific issues that will make patients feel more comfortable with their condition, but also manage it better. So even though they are not contractable, like person cannot get sick from one person to another, the burden or the effect that an NCD, a chronic disease, has on the family budget or economic situation or capability to work or welfare, well-being overall is really huge. This Global Week for Action on NCDs, it's not only important from the perspective of people with NCDs, but for the societies at large, because they impact everyone and everywhere.
Yeah, and I think, Neda, just to add to your point, I think you raise a vital point, and that is everybody is impacted by this. Let's just jump back in time a little bit and look at COVID and the pandemic. talking about the burden that it has. If you contracted COVID, what were you most worried about? It was taking that disease and exposing somebody else who had COVID. But what if those people had NCDs? They were at higher risk. So it was much more important, to really look at this communicable disease in the nature of NCDs, because again, what we've seen around COVID and the pandemic, awareness, getting communication, everybody talking about it, you can truly have an impact. That even though it's a non-communicable disease, its burden impacts everybody. And we can see those who have NCDs also are at higher risk of other diseases.
I think the partnership with Viatris and with industry at large really helps not only IAPO but also other patient organizations to bring that voice together, to work together, to develop resources, something that the governments maybe do not have enough attention for or don't have enough resources. So this is where industry and Viatris in particular with the Patient Academy that we mentioned as one example is coming through quite nicely and is coming with a lot of support for what the patients know from one end of the globe, how they can help people from the other end of the globe, let's say, or irrespective of how much we invest, there will be always new generations and we need to teach and train and advocate more and more. Hopefully we advocate with the governments to have a better policies, but we will always have new patients and new citizens to teach and train. And that is why the partnerships with industry and with Viatris, it is important for us because we always need that reiterative support in order to try to prevent as much as possible and provide education for as many patients as possible.
No, I like that. And I love the fact that, groups like IAPO, for example, and Neda talked about their reach, because, and the importance of a localized evidence-based solution, because every country is going to have a different solution that potentially works for them, because these have to be localized, they have to be evidence-based. And this evidence should actually be linked to societal determinants of health, which, as we all know, are specific for each country. And if you're not doing that, you're not going to truly have the impact. So this is another week we can do that. And again, why partnerships are so important, because you have to bring all of these aspects in that all the stakeholders have. So point well taken.
For us, the partnerships, public-private partnerships or partnerships with the government, with the industry, they mean a lot in the sense that they really enable the patient voice to be heard. And for us, hearing every single patient from every corner of the globe really makes a difference. Because after all, what we are aiming at is having less patients, hopefully, but wherever there are patients, at least that they are entitled and have access to dignified, high quality, accessible and affordable healthcare.